Before taking Xcopri 200 mg tablet anticonvulsants, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the medication whole with liquid, and follow your doctor's directions on how to take it. The dosage is based on your medical condition and response to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Use this medication regularly at the same time each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as suddenly stopping it may cause withdrawal symptoms. Your doctor may lower your dose slowly over at least 2 weeks to prevent withdrawal. It's important to take this medication exactly as prescribed to lower the risk of addiction. Keep this medicine in a safe place to prevent theft, misuse, or abuse, and tell your doctor if your condition does not improve or gets worse. Some common side effects of Xcopri 200 mg tablet anticonvulsants may include drowsiness, dizziness, tiredness, nausea, vomiting, constipation, decreased appetite, diarrhea, or weakness. However, many people using this medication do not have serious side effects. If you experience problems with walking/balance, coordination, vision changes, or feelings of spinning, you should tell your doctor right away. Also, seek medical help immediately if you experience fast/irregular heartbeat, severe dizziness, fainting, or symptoms of a serious allergic reaction such as fever, swollen lymph nodes, rash, itching/swelling, or trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. Remember to consult your doctor if you notice any unusual or sudden changes in your mood, thoughts, or behavior, as a small number of people may experience mental/mood problems while taking this medication. Before taking Xcopri 200 mg tablet anticonvulsants, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney or liver problems, mental/mood disorders, or substance use disorder. Xcopri 200 mg tablet anticonvulsants may affect the heart rhythm, causing serious symptoms that need medical attention. The risk of this condition may increase if you have certain medical conditions or are taking other drugs that can also affect the heart rhythm. It's important to inform your doctor of all the drugs you are taking and any heart problems you may have. This medication may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana can increase these effects. It's important to avoid activities that require alertness or clear vision until you can do them safely. Additionally, it's important to talk to your doctor if you are using marijuana. If you are planning pregnancy, become pregnant, or think you may be pregnant, it's important to discuss the benefits and risks of using Xcopri 200 mg tablet anticonvulsants with your doctor. It's also important to discuss reliable forms of birth control with your doctor, as this medication may affect the effectiveness of certain birth control methods. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also important to consult your doctor before breastfeeding while using this medication. Drug interactions can impact how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Xcopri may speed up the removal of other drugs from your body, which can affect how they work. This includes drugs such as isoniprevir, elacestrant, lanafarnib, ombitasvir/paridaprevir/ritonavir, and quizartinib. This medication may also decrease the effectiveness of hormonal birth control. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods while taking this medication. Additionally, if you experience any new spotting or breakthrough bleeding, it may be a sign that your birth control is not working well. If you are using other products that cause drowsiness, such as opioid pain relievers, alcohol, or drugs for sleep or anxiety, it's important to inform your doctor or pharmacist. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. If someone has taken too much Xcopri and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. It's important to remember not to share Xcopri 200 mg tablet with others, as it is against the law. Your doctor may also conduct lab or medical tests while you are taking this medication, such as liver function and potassium blood level tests. It's important to keep all medical and lab appointments to ensure the medication is working effectively for you. If you forget to take a dose of Xcopri 200 mg tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Xcopri 200 mg tablet anticonvulsants, it's important to keep it at room temperature away from light and moisture. Make sure to store it in a safe place, away from children and pets. It's also important to properly discard this product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.